Welcome to the new episodes of Healthcare Musings. I'm Nilesh Maheshwari, founder of eMorphis Health. As we record this podcast today, I recall 4 years ago when COVID 19 hit the world. And it has actually changed the way healthcare is being delivered in a profound way. Even before COVID, virtual care was being as a delivery model, but after COVID, this has altogether changed the way the care is being delivered, and there has been a lot of telehealth platform which have been cropping all around. And I remember that during those days we have been getting a lot of inquiries related to creating a telehealth platform. But in last 4 years, virtual care and telemedicine space has progressed significantly. And to delve further into this topic, I have Gina and Nancy. They are expert in this field and they have vast experience. So I welcome Gina and Nancy and invite them to introduce themselves.
Thank you so much for having us, Nilesh. We're really excited to be here. I'm Jenna. I am the CEO and co-founder of PocketRN. And my background prior to founding PocketRN is in the healthcare strategy and policy world, where I was working for many years in Washington, D.C. to try and form public-private partnerships around the caregiving crisis here in the U.S. Left that work and went to Stanford to get my MBA and Hopkins to get a master's in policy. And while at Stanford, our team came together to form PocketRN. So it's a little bit about me, and pass it over to Nancy.
Hi. So yes, I have been working in the home health, home care space for the past 2+ decades as a provider, and had an opportunity to meet the team at PocketRN when they were in the biodesign program at Stanford, and instantly could see all of the ways that the virtual nursing solution could enhance the quality of care that I was providing as a provider, and really solve so many of the problems that I was having related to staffing and access to care. And really excited to be here with you today to share more.
So welcome you both. So Gina, what made you co-found PocketRN and what is the problem you are solving?
Yeah, great question, Nilesh. So we formed PocketRN about 3 years ago out of Stanford Healthcare, really in response to something your viewers and listeners will be very familiar with, which is that we are facing an unprecedented crisis in care between how rapidly our population is aging and how rapidly our nursing workforce is burning. And we simply can't keep pace with the level and the volume of care and the high acuity of care that is required for patients on an ongoing basis throughout their journey. And without, broadly speaking, access to nurses, which our patients desperately need, millions of patients are literally sitting at home dying in front of their TVs as they get older. There are 50 million older adults today. That number climbs every 10 years by another 10 million. And we all know the numbers, but our view is that healthcare really happens for these older adults, not when they're sick and they're in the hospital, but it happens in those millions of little moments when they're at home. And a big part of what led me and other members of our team to ultimately found PocketRN is that I personally serve as a family caregiver to my mom, and I see this dynamic playing out all the time in our family. There are so many questions that come up. Is this, new symptom or new side effect a result of a new medication, or is it some new condition or diagnosis or something that we need to be worried about? How do I pull off this piece of gauze from a wound without making things worse? It's all of these little questions. It's education, it's care plan execution. And we make millions of decisions every day as patients and as caregivers that have a big impact on our quality of life, degradation, potential for hospitalization. But these are the things that are easily addressed by a trained clinician. And they're the things that often aren't valued in our system today. But it's the exact kind of care that nurses in particular were born to lead. They're the combination of the trust and relationship they can build with patients and families, the number one most trusted profession, with their expertise, their clinical skills, and their social and behavioral understanding. All of those come together and have for our family throughout my mom's journey. We've relied on nurses in our community, in our family, to help understand her diagnoses, to help support us as family caregivers. And we really sought to democratize access to that with PocketRN. We saw that we needed a new care delivery model that was powered by nurse-led care, and that puts nurses at the center. And there's really simply no way to do that, and really no need to do that entirely in person, because so much can be done virtually when you enable and empower nurses to practice at the top of their lesson. So that's ultimately what led us to build PocketRN. And PocketRN is a virtual nursing care platform that provides patients and their families with a virtual nurse for life.
Excellent. So, Nancy, what made you to join this cause?
Well, in addition to all the things that Jenna just said, which are very personal to me, I was a family caregiver for my grandmother who had dementia when I was in high school and through college. And so it's been a personal mission of mine. But also from being on the agency side of things and working with so many nurses, the burnout factor is real. And creating more innovative workflows where we can take unnecessary work off nurses' plates so that they can practice at top of license all times was very important to me. Having nurses feel valued and heard, and having a nurse community was very important to me. And so it's not just about the care that we're delivering, but it's about supporting the nurses. And, they're amazing clinicians who have some of the biggest hearts of all the people that I've ever met, who are often not treated really well at work. And so we really wanted to create an environment where they were heard, valued, and supported. And that was very important to me as well.
Okay, excellent. So, what are the key driving factors of growth of telehealth, and how COVID has actually impacted the adoption of telehealth?
There are so many factors behind this growing trend in telehealth adoption. And I'll start with a few, and I'll let Nancy add in a few others as well. Obviously, COVID-19 was a huge accelerant behind the utilization of telehealth, but really, there were underlying access issues to healthcare writ large long before COVID, and COVID was certainly a catalyst on top of those issues. So when we talk about access and barriers to access, just to give you a quick example, we have a patient who was diagnosed with a new heart condition, and they've been waiting over 9 months to see a cardiologist. To get in with a specialist today, you can be waiting months, if not even years. And so in the interim, within 5 minutes, that patient can be meeting, engaging with, getting help from a cardiac nurse who understands their diagnosis, can help them understand what this means for them, and help them prepare, even make some small lifestyle changes while they're waiting to see a specialist. And so access is a huge barrier. Another one that really stems from that we see a lot, particularly in the populations we serve, is because of these access issues, there's a lack of trust in our system today. And there's a lack of trust of clinicians, a lack of trust of hospitals, of doctors' offices. And that is really the fundamental pillar that we've built our care delivery model on, and something that nurses are so good at. And so with that lack of trust, we've seen folks really turn to different solutions, solutions that were designed with them in mind. Another big factor is obviously convenience and comfort. And when you think of millennials, that's very natural that, you want everything with your fingers. But we've seen what many people don't think of, and Nancy has seen this and knows this all too well, is as you age, it can be uncomfortable and even a little bit embarrassing to have a caregiver or a nurse come into your home. Your neighbors see it. It means that you have to kind of face the fact that you're aging. And so what we've seen is that telehealth can be a way for folks to access care earlier before it's really too late, in a way that's more discreet and comfortable for them. And then, the last thing I think I'll say before I see if Nancy would like to add anything else here is just technology adoption. We see that There are a lot of stereotypes out there, especially around older adults, which is our core demographic, around their ability to use technology, around their desire to use technology, and we're seeing that we've been able to significantly debunk that. And with our initial clinical trial that we ran out of Stanford, we saw that our average age of patients at that time was 70 years old. Over 90% used our platform with full functionality, full video visit. And what we're seeing in the market today is huge increasing penetration of smartphone adoption by older adults. 76% have smartphones now, which is a 15% increase from the previous year, and that trend is just climbing. And of course, access to technology is still a barrier in a lot of places, and solutions need to be designed for that and around that. I'm sure we'll talk more about that, but today we are seeing a lot of those stereotypes becoming more and more debunked. Nancy, anything you'd add?
Yeah, I would add about just a little bit about geography. When you have staffing challenges, and the majority of your clinicians live in urban areas, that's where they're going to service patient populations. But so much of our country is rural America. And there's a lot of windshield time when you're trying to deploy an in-person physician, nurse practitioner, nurse, to someone's home. And the drive time is going to be 2 hours each way, right? I mean, it's not really an effective use of time and resources. And it's very frustrating for those patients because the further they are out of the city, the harder it is to get anyone willing to go. And if they are willing to go, they're not willing to go, at a moment's notice. And so, we see that there's a lot of people being left behind just simply because of where they live. And telehealth comes right to your home. We meet you where you're in the mode and time that works best for you. And we're starting to see that convenience is actually leading us to behavioral change with patients, because the more that the relationship and the trust builds with that virtual nurse for life, the more that the patients and the families are opening up to us. And we're starting to see them become more accountable in their disease management process. And when their outcomes start to move in the right direction, they want more of it. And so unlike traditional telehealth that's very reactionary, so much of the work that we're doing at PocketRN is in that trust and relationship building and in that longitudinal relationship building, so that these patients are with us. And then as they see the outcomes moving in the right direction, they want more of it. And that's really rewarding. A proactive versus a reactive approach primarily.
I think that there are very good points which you have raised in the light of adoption of telehealth and why people would choose. I think rural health care system need to be strengthened, and I think telehealth plays a very important role. And another point which Jenna, you have raised is that because of the care, the providers and availability of expert opinion takes a lot of time, and you are in a queue, and there are patients who cannot wait for that long. Telehealth enables them to actually get that opinion faster and at their home space. And one of the very key point which I understand is that the discreteness of the interaction, people would never know that whether you are undergoing through any kind of treatments. And that is one of the point which I have never actually thought of, but I think that is a very valid point which actually has a social impact, and probably that actually elevates the patients from these kind of situations, which is so I have been talking to some of our clients for whom we have actually developed the telehealth solutions, and there's still people say that the adoption is still a challenge. People are not too much prompt in getting to a telehealth solution. Is that you are also seeing, and are you addressing that situation by any means?
No, it's a great question, and my initial answer is yes and no. What we would say is that we see adoption growing, but we see that access is still an issue, and where adoption is floundering a little bit is in response to what Nancy had brought up before, which is that when you look at telehealth, sort of traditional stereotype of telehealth, which is reactive, the patient has to initiate using it. It's physician led. It's often low quality, sometimes even long wait times for telehealth solutions. And you don't often get much more than a transactional result. In those kinds of circumstances, we see why people might be averse to using telehealth and using it in a way that's most effective for them, which is why using telehealth in a proactive way, as Nancy mentioned, where clinicians are actually helping to guide the care, they're proactively reaching out to you so you understand how to use the solution, they're checking in so that we can catch things early. That is hugely powerful in terms of adoption. And that's what we see a lot on our platform, is that having a proactive and a combination of the proactive and the reactive side is really powerful, because patients start to understand, oh, I can use this. And as Nancy mentioned, this does help me. And so now I'm going to use it more consistently and use it earlier. I think there are a couple other interesting trends that, we see here. So another stereotype to debunk, the demographic of older adults, 65 plus, are actually the highest utilizers of care among all subsections of adults. There was even a recent study from JAMA that said that 1 in 3 older adults want online only care, which is huge. That means they would prefer to have all of their care online than to have their care in person. I think that's a big testament to some of the things that we mentioned earlier around lack of trust in the system, lack of access. There's a long list of things that we need to do as a system to improve access around reimbursement, policy, infrastructure. But there are really, really a lot of bright spots that we're seeing. So, I'm very excited that just yesterday PocketRN were accepted to a new CMMI, Centers for Medicare and Medicaid Innovation program called GUIDE, to support dementia care for patients and especially for their family caregivers. And what's really interesting about GUIDE is it's a 9-part care delivery model, and almost all of those 9 parts are virtual, are virtual first, or virtual only. And so what we're seeing is that CMS is saying that there's a huge need for patients. It can be fulfilled by primarily virtual care, and they're going to pay for it and reimburse it for over 8 years for the 6 million dementia patients and their families that need this, which I think is a great testament to the growing need and acceptance of telehealth and how it can benefit so many people. So I'll pause there and let Nancy add in her perspective as well.
Well, I would definitely say that, supporting unpaid, untrained family caregivers is extremely important. When something happens to mom or dad or grandma, people stop working for a week and we're in the hospital and we're supporting, that patient for that time period. But then especially those of us that are in the sandwich generation, we have to go back to work. We have to take care of our kids, and we can't be there during the day when a home visiting physician is there or a home health agency. But we are the people that are there at 8:00 at night when we stop by after work to see how mom and dad is doing and realize, oh, maybe they're not doing so great. And what's the first thing that people do? The knee-jerk reaction is to get them in the car, take them to the urgent care or to the emergency room, where now they become susceptible to far more infections and other communicable diseases. And so at all costs, whenever we can try to avoid that in-person unnecessary visit to one of those settings, we see that care is dramatically increased and that people's outcomes are increased. So that's number one. But I also go back to the proactive nature of what we're doing, really trying to change people from that reactionary, knee-jerk reaction when something happens. I always like to say, having that continuity of care is incredibly important to patients and their families. No one wants to have to tell their story to 10 different people 10 different times. And I think that's part of why telehealth doesn't have the adoption in other settings like the way we do at PocketRN, because we become an extension of the care team and of the family. That nurse can go with you through any level of care throughout the entire continuum. If you do have a hospitalization, you can still have your nurse in your pocket. If you're going to a physician appointment, you can still have your same nurse in your pocket. If you're moving to a senior living community, the PocketRN nurse can be with you, and we can be that familiar face to support you. And so we're not trying to fragment care at all. And we embrace all of the partners throughout the continuum of care. But we're really there to give that patient that consistency and that continuity and supporting them and their family members throughout the entire journey. And I really, truly believe that that's the biggest differentiator between PocketRN and every other solution out there.
Okay, that's great, and congratulations to PocketRN for the selection in the new program, and good luck for the success of that program.
Thank you.
Thank you.
Uh,
Thank you.
Seems you are very excited and look forward to it, and we will see more news about PocketRN in coming days. Great. So, in your experience, has telehealth improved patient engagement and adherence to treatment plan?
I would say yes. We're seeing patient engagement up of 80%, and it's really, again, due to the proactive nature of our nursing workforce. These nurses are building trusting and empathetic relationships with the patients and their families immediately. And we're supporting them in their wellness journey. And we want to not just deliver quality care, but we also want to have an understanding of what is important to that patient. Maybe it's they want to attend their granddaughter's wedding, or maybe they want to, show up at a graduation. And if those are the things that we can support, that outcome of them having a good episode of care, then, we really want to bring in that personalized touch to the patient in their journey. And we see that it's working.
Yeah, I think it's a great question, Nilesh, and improving patient engagement and adherence is probably the biggest opportunity for telehealth if done right, because it creates the frequency and consistency of touch points to actually help change behavior through relationship building, motivational interviewing. And that's really why at PocketRN, our core workforce is nurses, because nurses are phenomenal at this. And it's often the physician that designs or sets the initial care plan, but it's really nurses who execute on that care plan, because we all know, you leave the hospital, you get your discharge instructions, you get your new care plan. A lot of that knowledge goes right out of your head as soon as you get home. And nurses are the ones who can be with you throughout that journey. And in all those little moments in between the in-person visits, to be able to provide this extra layer that enables patients to get more engaged in their own care. And we've seen, as Nancy mentioned, tremendous results around that front. And, I think that there's a really good reason why we don't say doctor you back to health or therapist you back to health. We say nurse you back to health, because that is the role that nurses play in helping you really execute on those goals. And that care plan. And, among all of the results we've seen on our platform, we've seen patients lose 30 plus pounds, drop their blood pressure, quit smoking. But I think the most meaningful thing is when we hear our patients say that they finally feel seen. And we hear that time and time again. And that is the kind of thing that really gets people, engaged and consistently trying to make themselves better and have their, improve their health with what is within their control. So that's one of the most exciting things, for us. I think if telehealth is done right and it's not done in a purely reactive, purely physician-led, way where it's just left in the patient's hands to decide, when to engage and when not, then it's not going to succeed. But if you take a proactive approach, you take a continuity of care approach, then you'll see tremendous results.
Okay. So, does telehealth is more effective in particular areas of healthcare, like chronic care, disease, or chronic disease, or mental health, or post-surgical? Is there any experience where you can say that this is more effective in particular areas?
It's a great question. And, we see value in telehealth as a care partner to a patient and their family throughout their entire lifetime and journey, but there are certainly spikes throughout that journey. There are big, major events or triggers that are really important to be aware of, and where we see increases in engagement and utilization because there are higher needs. Those are typically pre and post acute, before leading into an inpatient episode or a procedure, and after the fact, when you're in recovery. Chronic disease management is huge. So we work with a wide variety of different patients, COPD, CHF, hypertension, diabetes, strokes, falls, dementia, Alzheimer's. We really cover it all. And especially when there's a new diagnosis being added to the mix, or a new event, particularly for the patient to help them understand, but even more so often for the family caregiver or the caregiver, so that they know what to watch out for. It's really important to understand these triggers, but it gets even better if you can follow patients throughout the entire journey, not just around the triggers, because care just gets more and more complex over time. And we look at patients really holistically at PocketRN, and not just siloed by their diabetes diagnosis or their CHF diagnosis, because the combination of those two things is something very different than one or the other on its own. But really, there are access and capacity issues throughout the entire journey, with people needing more and more complex care. And so the more that we can hybridize care, not replace in-person care by any means, but insert telehealth into these parts of the journey that are more intense for the patient and their families, those are really the points where it has a huge impact, even just in providing peace of mind.
Okay. Do you see that telehealth has some ethical considerations? There need to be some ethical considerations, or there are potential limitations in using telehealth?
Absolutely. Nancy, do you want to start off when you've seen it in real life so many times?
Yeah. I mean, I think that, what we have built at PocketRN has a really strong compliance aspect, and we also have nurse practitioner and physician oversight, even though in many of the partnerships that we have, it's not required. And I do think that that's one of the ethical considerations in telehealth, because really our platform is documenting how long the visit is, when the visit was done, it's time stamped, and really being able to have that compliance and physician oversight, I think, is incredibly important. And it's something that I think people don't really think about compliance, and really having that regulatory oversight, even when it's not necessary, just to sort of do a blood pressure check and make sure that the nurses are documenting things correctly and that they're making the appropriate interventions. And so I would say that for us, that's something that's incredibly important to us as a company, but I don't see that adherence necessarily across the board throughout the entire industry.
Okay.
And I'll just add that, we've been talking about kind of the positive scenarios of caregiving, where you have an involved, engaged, and legally allowed family caregiver, or POA, who is helping to care for a loved one. But there are certainly lots and lots of cases of abuse, neglect, of non-POAs acting as POAs. And those are all really important considerations and things that we spend a lot of time training our nurses on, in addition to understanding what you can legally share with a POA versus not. Just keeping an eye out for instances of abuse, neglect, understanding how to report those, how to escalate those. We have escalation protocols built into our platform for exactly those kinds of circumstances. And what we found is that when you are meeting with someone in their home over a video visit, you get a much better picture of what is actually going on for that person at home and with their family and in their community. And there are certain situations that I would bet that most of our patients, clinicians who solely see them in the office or solely see them, in the hospital, would have had no idea about. And so this gives us an opportunity really to uncover and ensure our patients are as safe as they possibly can be. So those are a couple other cases that we see from time to time.
I would also add that really, assessing the patient and their acuity level to make sure that when we are having a nursing visit for someone maybe that's, bedbound and having difficulty moving, that the nurses are still doing a head to toe assessment. And that because wounds can be, someone could be sitting in a chair, and if you're not doing a head to toe assessment to make sure that there's not a wound on their backside, that could put that patient at risk. And so, again, it goes back for me really back to compliance, making sure that you have best practices. What I always like to say, and I think this is really an important factor, we're sitting on Zoom today, but telehealth is not just putting a clinician on a Zoom call. It's not. And I think a lot of people in the industry think that's what it is. It is not that simple. There is a lot of time and thought into clinical pathways, into best practices, into compliance, into regulatory oversight, into, not just billing and coding, but to really having an understanding of patient acuity and when telehealth is appropriate and when to escalate to in-person people. And I think that that's another big differentiating factor with PocketRN, that because we have such a solid team that has been in the business for so long, that we know exactly when and how to escalate to an in-person clinician or to an in-person hospice, home health, home care, really being that coordinator of care that is being led by a nurse who becomes that quarterback for the team has really been beneficial. And I think it's a game changer.
And I think you have raised a very valid point here, where we need to have boundaries of where the telehealth uh, can be relate to and will be relate to the home care or the real actual visit of the doctor or to the or the patient to the hospital. So there has to be a very clear understanding of that boundaries, because otherwise it will be like it may create some risk over the a virtual visit only.
Right. And I think that our team has done a really good job of trying to defragment care. When we're starting a partnership, we want to know who these other providers are, and we introduce ourselves to them, because it's very easy for an in-person clinician to think that we're trying to steal their patients. And we're absolutely not. We're trying to help those in-person clinicians, yet again, practice at top of license. And the communication between our team and their team really is important to driving that positive outcome for the patient. And so I think that we go above and beyond and really trying to defragment care and enhance communication, which I've said for 20 plus years that communication is the simplest yet hardest thing to achieve in healthcare. And the more that we can communicate, the better off everybody is. And our team does a really good job at that.
Excellent. So what are the key steps that need to be taken to ensure the equitable access to telehealth for all patients?
Yeah, great question. And there's a long list here. Thing from policy and reimbursement to infrastructure, and I think, but most important, the ethos behind all of that is really having the human-centered approach of meeting patients where they are, of all walks of life, all backgrounds, all geographies. There are a couple things that we see as huge gaps still. One is ensuring that patients get equitable access in their native language or their preferred language. They get access to a provider, a clinician who has cultural congruency with their background, or is able to meet whatever their preferences might be. If you're a woman and you would prefer to meet with a female nurse, making sure that is built into all of the platforms that are delivering telehealth today. That's a key part of what we do, is specialty matching patients and their families to nurses based on their specific needs and key factors, and doing that in a way that promotes the most inclusive solution that we can. But we don't see that across the board just yet. So certain solutions are moving in that direction, but we'd love to see that more, because telehealth really does break down a lot of boundaries and really breaks down a lot of supply demand boundaries that you can't get in person. So meeting those patients where they are, especially if they are living, as Nancy mentioned, in rural areas, in areas with limited access to technology or internet. A couple things to keep in mind here. If you live in an area where you don't have broadband, you don't have satellite, you probably also can't get to an urgent care or an ED that easily. And so, when we're thinking about expanding access beyond the status quo, thinking about how we can deliver technology and internet access to rural areas around the country and around the world is really a huge way, more than building a hospital in their area to increase care. This is something we invest a lot in at PocketRN. We obviously have a video enabled solution, but for those patients of ours that don't have access, don't have a device, we do all of our engagement via landline. So if they want it, they don't have a smartphone, they don't have any kind of video enabled device or internet, we can do everything down to landline, text message, whatever works for them. And we've worked with quite diverse populations, rural populations, homeless, unhoused populations, getting more access to care for women, for people of color, all across the board. And so, I heard I think the last thing I'll say around equitable access. I heard this from another telehealth expert, so I can't claim it. But we often we struggle to get over this hump of how do you get video enabled devices to everyone. And the way she put it was, what we haven't realized is that the only place where we don't have video enabled devices is in the hospital. That is the place where technology needs a pretty big revolution as well. So there are ways, if you invest in getting devices to people, training them on them, improving their confidence, empowering them, there's a lot we can do. And those are a few things that we've really put a lot of time and attention to, so that we can make sure we get access to all of our patients.
Sure. Like we have been working on a lot of remote patient monitoring solutions and integrating devices, home devices into chronic care management or into telehealth solutions. Have you ever thought of like integrating these devices for chronic care management, where the nurses are getting the regular readings of vitals and they can take care of the patients accordingly? Or introducing artificial intelligence so that it can provide a predictive notifications, whether based on certain vitals or combination of vitals, you can then automatically there are alerts which are getting to the nurse and they can then take the appropriate action. Is that something you are already doing or thinking of doing in future?
We are doing RPM and CCM and RTM for clients across the country. It's a big lane for us, working with so many physician practices across the United States. We know that a lot of these groups want to do RPM and CCM, but they just don't have the bandwidth, and their staff is already overwhelmed and busy, and it just becomes another pile of work on top of their existing staff, which does not drive satisfaction. And so we've seen a lot of success where we can bring our nurses into the practice to manage the alerts, to triage the alerts. And our chief medical officer, Sam Thomas, has done an amazing job at building clinical protocols around RPM. And so it's definitely a lane that we love and we love supporting. And it definitely helps our nurses work, work in a smarter capacity, if you will, than versus having outbound touch points with patients. We actually are able to see and track trend. We've had our nurses actually share the trending reports with our patients, our mutual patients, and they say they love being able to see how the interventions that they're making in their own wellness is driving the outcomes that Jenna's mentioned, like weight loss and, lower blood pressures and all of those kinds of things. So it's a lane we love, and we're hoping to continue to grow.
Yeah, and I'll just add a couple examples of the partnerships we have today. RPM is one of our three verticals that we serve, RPM and CCM. We have a partnership in Maine with Penobscot Community Health Center and FQHC, as well as with an RPM partner, HealthSAS, and an AI partner at Helix. And together, this combination of RPM devices, AI-enabled alerting and reporting and tracking, and virtual nurses has been hugely powerful in serving the patients and the community that Penobscot, that this FQHC serves. And what we find is it delivers value back to the patients, as Nancy mentioned. And it's simply, it's a whole program and implementation process in and of itself that the very, very strapped clinicians at health systems or community health centers simply don't have the time for. They're so strapped for time. And so, I think above and beyond the value to the patients, the value to the providers that we work with and serve, there's also just tremendous value to our nurses, as Nancy mentioned. There's so much opportunity, and we're doing this in a lot of different fashions today, to use technology, whether it's RPM, whether it's e-learning partners that we work with, whether it's photo, video-based technologies and analytics for assessing wounds or medication management. There's so many technologies and advancements in AI that can be really helpful and have been really helpful to our nurses so that they can practice at the top of their license. They don't need to do they don't need to do repetitive tasks. Those can be automated for them. And we can, most importantly, use that precious clinician and patient time as effectively as possible. So nurses don't have to be worried about doing too much documentation after the fact, or can have data at their fingertips without having to extract that through communication. There are all sorts of tools that have been really, really helpful to help our nurses practice top of license, and time is limited, and so to make the most of it, is really huge.
So when you say that documentation is not required and it is all used by a tool, so are you like using something which is like speech to text and then creating the complete patient interaction charts and then pushing it to EHR from within the system? Is that something?
Great question. So stay tuned. We're working on a new process, and either working with a partner or using some of our existing technology to rapidly decrease the amount of time that our nurses are spending doing documentation, filling assessment forms. There are a lot of really interesting technologies out there today that do this. So they'll do auto transcribing, they'll do documentation. They're just increasing advancements with Chat GPT-4 that can be used in really interesting ways, building your own HIPAA compliant instance and layer. So we are looking at a few different new solutions to deploy. And really what we predict that we'll see is that this will add another 50% of time back to our nurses in order if we have a solution that really works for them. And a big part of our scanning of the landscape and of working on this, building our own technology internally has been just how do we build this around the nurse? Because most of the technologies we see out there today have been built around the physician. And so we always start there. We start with the biggest pain points. Documentation is one of those pain points. Even assistance with clinical decision making. There are a lot of areas where we are starting to use AI and automation to support our nurses primarily and get more information back to the patient. So stay tuned. We may have some more announcements on that front.
And I think you should also look into Copilot, one of the very promising technology which is coming up, and it is beyond transcribing. It has so many other facets of facilities where it reduces time of like documentation, even creating charts. So providers, it is going to, like as you said, it is going to give back 50% of their time. And they say that the doctors or the nurses can utilize that time in actually giving in the caregiving rather than writing, documenting, or filling up the forms or anything. It is more focused on caregiving. So exciting times ahead, and sounds interesting that you are already like ahead of that curve and working on all of that. Great. So I think this brings to the end of our podcast. And do you have any closing remarks? Do you want to say anything about PocketRN or anything which you want to talk about telehealth or anything which you have not yet covered?
I just want to thank you for your time today. I think we covered a lot of ground, and we're just looking forward to helping more and more patients and their families and their healthcare journey.
Absolutely. Yeah. No, we really thank you, Nilesh. This has been a really phenomenal conversation and opportunity. And, we think that the future is very bright. Of course, we think that by having a nurse for life, a nurse in everyone's pocket, it'll really dramatically change the way that people receive care, and really having that glue, that care partner with them for life is something that everybody deserves. And our system hasn't been built around yet, but generally speaking, for telehealth, we're very optimistic, and we see more and new exciting innovations every day. And I think it won't be long before telehealth is just called health, the same way cell phones are just called phones. And the best way to do that is actually have it be integrated into your healthcare, into your in-person care, these hybrid models, where you're marrying PocketRN or another telehealth solution with a home care agency that's got a professional caregiver on the ground, and with an RPM solution, or with an FQHC, or with a visiting home physicians group. There are so many ways to marry these two sides together, and build the care of the next century that we believe all of our loved ones should have and deserve. So we're looking forward to seeing what's to come, and really appreciate your time, Nilesh. Thank you.
Thank you, Gina, and thank you, Nancy, for your time. And it was an exciting discussion around telehealth and PocketRN. And definitely good luck to you, to PocketRN, to you both, and to the team for creating an excellent solution. And congratulations on the new program in which you are selected. And thank you, everyone, and for watching this episode. Thank you.
Take care.
Thank you.